Okay, so yes, thank you again. And most of the focus today will be on Roman medical tools, but just to get started, the sources of information that we find out about Roman medical tools come from ancient literature, ancient medical literature, philosophical literature, and also historical works. Then we have the archaeological remains, which I'll be talking about mostly, and also we have images of tools and arts. The Roman writers that tell us most about medical tools and their uses, their functional medical uses, are Celsus in his book De Medicina. It's an encyclopedic work. Specifically, books 7 and 8 are important for surgery and bone surgery. And he lived in the 1st century CE. Galen, who was a prolific writer, a medic, as well as doctor to Marcus Aurelius, wrote a lot on surgical procedures, and we have information from him. Much later, in the 6th, 7th century, we have Paul of Aegina, a Greek writer, but he repeats a lot of what Celsus and Galen says, along with Aetius of Amida, another surgical writer in the 5th century CE. And then for gynecological procedures, we have Cyrannus of Ephesus, also a Greek writer who lived in the 2nd century CE. So I'll be referring to their works. To understand Roman medicine and Roman surgical procedures, we have to fit it into the holistic situation of Roman medicine, and it is generally based on humeral theory, which I'll explain in a second, and that's the image on your screen. Along with Roman medicine, there are surgical procedures, dietetics and diet, pharmacological remains, where we can look at plants, animals, and minerals. They write a lot about regimen because the idea was you want to avoid the doctor and medical treatment as much as possible. So they write a lot about spending time in healthy gardens, healthy environments, and spaces. They mention exercise and diet again. And everything is referenced for your age, your gender, even the career and your dwelling location. These all have an effect on health and the humeral system. And then there's also ritual care. The humeral system is important to understand because they believed that in the ancient Greek and Roman period, and this goes well into the early modern, and we've heard in the other papers as well, ideas about balance and bleeding, and this all relates to the humeral theory. So they believed that the body was made up of 4 humors: blood, yellow bile, black bile, and phlegm. And these had properties of blood was hot and moist, yellow bile hot and dry, black bile cold and dry, and phlegm was cold and moist. And these related to seasons, age, and so on and so forth. But the idea was that you had a healthy balance depending on your age and gender and dwelling location of these 4 humors. If one of these humors gets out of balance, then you're ill. And therefore, they might actually recommend what we would consider some surgical procedures. Cupping vessels and bleeding were the 2 most common references in most of these books that I mentioned. They used dry cupping in case they wanted to remove dry humors. You place this on the body, you heat the cupping vessel. That's the instrument in the middle of your screen. They're generally made of copper alloy, though there are references to them in horn as well as glass, but generally copper alloy. The surgeon or medic would heat these up using a piece of flaming lint, put them inside, heat the tool up, and place this on the body where it creates a suction. And that would supposedly remove the bad humors from the body. They could also do wet cupping, where they would make an incision and then put the cupping vessel on top. And this also would remove excess liquid in the body, usually blood or perhaps even phlegm. So this tool was to create a balance, a healthy balance, if something were making you ill. We have lots of images of these. I've shown 2. The first one shows 2 cupping vessels, and it surrounds surgical knives and scalpels. And that one's from Athens. And then on the far side of the screen, we actually have a doctor named Jason. It's Greek. It dates the 2nd century CE, and it shows him repairing, examining a patient. And it shows another cupping vessel next to him. So the cupping vessel also seems to be a symbol of doctors in the ancient world, much like we see doctors with stethoscopes today. So the cupping vessels are common. Along with cupping came bleeding, and this also would help to balance the body. And there are lots of references to this being practiced just for general health and excess of wet humors, especially blood. And here we have an image. It's a Greek image, probably dating to the 4th or 5th century BC. It's on a tiny little pot in pyxis. It's a red figure vase from Athens. But although it's mentioned in Greek literature, it's also mentioned in Roman, and we have it all the way up to barber surgeons. So it starts very early on. Okay. So bleeding and humeral balance were two probably most commonly mentioned references where we use some type of medical instrument. However, there are multiple medical tools found in the archaeological record and mentioned in Roman and Greek medical texts. Most of the instruments are quite basic. They're things that you can use for many different purposes, and I'll describe them. And also, they're most things that people tend to have around their household, or if they're artists, for example, may use in artistic productions. So some of the basic tools, what we see here are tweezers that were used for removing small splinters and pieces of bone or holding skin apart. And they're also from removal of hair from the body. So these could be personal as well as medical. And that's what we see on the different shaped tweezers on the left side of your screen. And then on the right is a famous picture of medical tools, possibly from Italy, that's in the British Museum. And I'll be looking at these tools individually, but and cut and paste these to describe them in more detail. What you also need to know about medical tools is most of the ones found in the archaeological record are copper alloy. But we do have references to them being made of bone or horn, particularly for the cupping vessels I just showed you. There are references to some using screws which were made of wood, but rarely do we find that mentioned. Iron is used for tools with cauterization, or sometimes bone working tools. And as we'll see, some bone working tools look very much like blacksmith tools. So sometimes it's hard to determine what they were used for. We have to look at the location in which they were found. Then we also have reference from Galen, the Roman writer Galen, about the use of steel blades for scalpels. And I will talk about the steel in a minute when we talk about scalpels. So just look at some of the more common instruments and their functions. We'll move to the spoon, spatula, ear, and simple probes. These are found, these are some of the most common tools along with tweezers that have been found in the archaeological record. The spatula probe, which are the first three that you see on your on the left of your screen. This involves, they range from about 7 to 10 inches in length. Thin handles, the handles can sometimes be decorated, but for the most part, they're quite simple. They have a leaf-shaped spatula blade on one end, and this was generally used for mixing ointments, putting ointments on the body. It can be used as a tongue depressor and also as a cautery. It can also be used to hold skin open for surgical procedures. On the top end are what's called an olivary probe. And these are a sort of an olive-shaped bulbous probe at the top. These were used for probing wounds, applying small amounts of ointments, mixing ointments, small cauteries. So they, again, have multiple functions. And these can also be used by artists to mix paints. So again, we have to look at the location in which tools are found to determine if they have a medical or other use. The next one are spoon probes, very similar to the spatula probes, but have a long, elongated spoon, usually for just removing medicines from vials. And again, the oliveri probe at the end, again, very common. Then also we have ear probes, which are the two small with small ones on the far end, which have a small spatula. This is generally used for just cleaning the ears. Kelsis also recommends something rather gory for using them to remove bugs from the ears. I don't know how common that procedure was, but it is mentioned. And then they can also be used for using measuring small amounts of medicines in pharmacological procedures. And then there are also simple probes, which have double oliveri end on both ends. They're less common. The interesting thing about these tools is a lot of times we find them broken, and sometimes they look like they were reused, and they may have been reused as probes or other objects. One I know in a record has actually been bent over, and it looks like it was reused as a bracelet. So these, when they can change their uses over time. But as I said, these are very, very common because of their multifunctional uses. Another common and important tool for the Roman medics, for a Roman doctor to have, was scalpels and knives. So these are usually have copper alloy handles. The scalpels have rectangular, short, blunt, squat, rectangular handles for the most part. One end is a leaf-shaped blade, which is used for lifting parts of the body, or help with the removal of something on the body if you do not need a sharp blade. And then they have a slot on the other end. Usually what's missing are the blades, and these were made of steel. And there is natural occurring steel in Noricum, which is Austria today. And Galen, the Roman writer Galen, actually said that the steel from Noricum was the best for surgical blades. And the procedures that they would do for this, besides cutting for bleeding, was the removal of growth on the body, cutting excess skin, and also in surgical procedures, if they were removing parts of the bone and you needed to slice the skin open, they would use a scalpel. These are commonly found. Another reason they're commonly found is we find them in tanneries. So they're useful for cutting leather in leather working. So they do have multiple functions as well. The picture, the ones with the long thin handles that you see in the middle of the screen tend to be used for more detailed procedures when they might actually have to go deeper into a body, particularly when they're removing missile heads like arrowheads, spearheads from the body, and you need a longer handle. They're also sometimes used for bleeding as well. And then some steel blades do actually survive, and that's at the bottom of your image there, but generally they're rusted away. So again, they're also used in procedures involving bone work, and as we'll see, particularly with the amputation of limbs. So again, very, very functional there. More precise, but often commonly mentioned, are catheters. They do talk a lot about, the writers talk a lot about stones in the urinary tract and in the bladder. The surgical procedures are extremely painful. They did perform them. They're not mentioned. They don't recommend them unless there's a last resort, but they do talk about using cauteries. A few have been, catheters. A few have been found. The long curved catheters are for the male, and shorter straight are for female bodies. And as they say, generally for blockages in the bladder and urinary tract. The way they work is, if you can look, if this works right here, usually this is the rounded end. Then they have a hole or an incision. These are hollow. So when these were being inserted into the body, they're smooth at the top so they don't cut. and then urine was able to drain through, and then there's a hole at the bottom, and that is the same for the female as well. So they do show that they had a good knowledge of anatomy. Anatomical studies were undertaken generally on animals, but there's a short window during the Hellenistic period where humans were allowed to be dissected. And it seems like there's a lot of dissection of human bodies, even without, even when it was considered a crime. So the surgical instruments give us an indication of their awareness of anatomy. Bone surgery is another treatment. It's commonly it's recommended for broken bones, fractures. They do know how to set bones and fracture, and also set for fractures. But also they do recommend amputation, and they did practice amputation. So some of the tools they would use for that would be saws. They also have drills. These are just, sorry, very blurry images. It's hard to actually find a good image of what a Roman drill saw would have looked like, but we do have descriptions of them. And these are drawings of people trying to understand how they would have looked from the way they're described in literature. With the idea they could drill through bone. They did practice trepanation, which was removal of bone from the head. There are a lot of skulls that survive that show that people survived this surgery during this period, particularly because there's examples of bone regrowth. So people did survive these surgical procedures. We know they survived amputation, and amputation was pretty much the same way it's practiced today. An incision was made below the bone, on the skin below the bone, that needed to be excised, and incisions were made up the skin's rolled back. Unfortunately, it's all very gruesome, but then the bone is sawed and then also smoothed off, and then the skin overlaps and is stitched up over the bone. It's pretty much the same as they do today. Unfortunately, though, there was no anesthesia. And most people, we have no records, but it's assumed most people may have gone into shock or could have died of sepsis, but we don't have any records of numbers. We do know that people did survive, however. And the tools that you see right here on the left side are actually for lifting bones when they had been crushed. So there are bone lifters as well. And book 8 of Celsus gives us a lot of information about the surgical procedures performed for bone surgery. Another rather gruesome surgical procedure, but one that seems to have been quite common, was the removal of cataracts, or I should say couching of cataracts. They didn't remove them like they do today, but they were able to put a very thin needle into the eye and push the cataract down. We have descriptions of it. And that sort of surgical procedure, it was actually performed up until very recently. So it's not unknown to us. And the way the Romans described how it functioned and how they performed it is very similar to what we know of today. What I'm showing you here are what's possibly a needle for eye surgery. And then we have another one here without the needle in the head, again, copper alloy. These tend to be found in sets in these circular or cylindrical containers, also made of bronze. And interestingly enough, we have some images of people getting their eyes treated. This one here is from Ravenna. And the patient is sitting, and it seems like the medicus ocularis, or the eye doctor, seems to be either putting ointments in the eye or perhaps performing the couching of the cataract. And we have another image of a cupping vessel behind, and that's from a tombstone in Ravenna. But what's interesting about the surgical procedures for eye functions is most of the evidence comes from Gallia Belgica, Northern Gaul, and also Southern Britain. So there seems to be a geographical preference for this sort of procedure. And why, I do not know, but there are definitely regional medical practices that we find throughout the Roman Empire, and eye surgery, eye procedures are common to, as I said, Belgium, Gaul, Netherlands, and southern Britain, as we know it today. This inscription or relief sculpture from an inscription was found in Gallia Belgica, and I'm showing it because it was also showing somebody having their eye operated on. Again, the patient is standing, the doctor is standing, but what's interesting is the doctor has his foot on the patient's foot, most likely to hold them steady, because, you know, it would be rather disconcerting to have something come at your eye. And we know that the doctors would have helpers to hold the patient down while these procedures were being performed. These procedures were likely performed outside or somewhere where there was a lot of light. So we have to think that places where surgery was performed was not like today where we go to an operating theater, but most likely somewhere outside or in the patient's home. But they had other places and marketplaces as well as public baths. So there's evidence for that too. Also, just, I'm not certain what's going on, but since this image is on the tombstone, it looks like this is an image of an infant. It seems like an infant's being swaddled. We do have lots of representations of swaddled infants. Whether this doctor also looked after infants or whether it's just part of the person's life, I don't know, but I just wanted to mention that as well. But again, the common procedure is the eye surgery. Also found, also related to eyesight and was what we find are medicines. Most of the medicines requested for eye problems are for poor vision. As people get older, as you can see, I'm wearing glasses, they just, you know, vision wanes, and so they have lots of medicines to try and help that because they didn't have glasses. We find a lot also in Gaul, northern France, so basically Belgium, the Netherlands, northern France, northern and central France, and also sometimes in southern Britain. These Calleria stamps are found. They find them in other areas of the Roman Empire, but for the most part, the majority of them have been found in France and Belgium. And these are for stamping eye medicines. So the stamps themselves are usually little square stamps. They're fairly formulaic. Each side will have the name of a different medicine. This one says penicillin. It's not the same penicillin as we know. Then in reverse on the side, so they can make a stamp, usually you have the name of somebody. It's thought to be either the pharmacist or the doctor. Then the type of medicine. So it will give the name of the medicine. In this case, it will be penicillin. And then the cure. And for the most part, the cure is usually for clarity of vision, but sometimes they have cures for conjunctivitis. We know that was quite a common issue that people suffered from because it's so highly contagious. What's fascinating about these stamps is the majority of them are made of green stone, so schist and green sandstone. And there's evidence from a lot of other Roman literature that looking at the color green was actually very, very good for the eyesight. And it's possible that the green stamps used on the medicines would somehow imbue that greenness onto the medicines themselves when they were stamping them. And then when the doctor mixed the medicine to put on the eye, they would have something green in them, as it were. But yes, green, just to go back to green, Pliny the Elder, who writes in natural history, mentions that people who worked on very tiny carvings were expected to stare at emeralds every so often to rest their eyes. And the Roman writer Vitruvius on architecture also recommends that people should walk out and look at green things like green plants, green trees, because this would clear the bad humors in the eyes and clear up vision. So there is something interesting about the color of green and eyesight going on in the Roman period, and we see this also represented on the collirium stamps. So the majority of them are made with some form of green stone. And as I've mentioned, these collyrium stamps and the evidence for medical tools for the eyes and medical doctors for the eyes also tends to come from the northern regions. So there are regional medical concerns, and they show us that there are cultural differences in understanding of the body throughout the Roman Empire. So although we consider the Roman Empire a cohesive unit, at the same time, it's made up of very many different people with different languages, different cultural practices, and different beliefs about the body. So that's an interesting thing about eyes. Moving on, there's a lot of it written about Roman military medicine, and particularly because it's a lot of interest in surgical procedures for wounds and battlefield wounds, as well as also soldiers just being sick or diseases going around a campsite. If they're living in such close quarters, obviously there were illnesses that soldiers had to deal with. What's interesting about the Roman medical practices is that when I actually wrote my PhD on this, when I first started looking at all the books I read said there was an assumption that medical care was the same throughout the Roman army, but there was no supporting evidence to back that up. So I just had a look at the medical tools and inscriptions and found that actually there isn't a lot of evidence to back up that medical care was the same. That doesn't mean that soldiers were denied medicine, but like what we found in Gaul is that perhaps they're bringing their own medical practices with them, something they trust and feel safe with. It's units from Gaul and units from Spain that tend to have the most evidence for Roman-style medical tools, whereas those from Rhaetia, which is now pretty much Switzerland and Bavaria, Noricum as Austria, Pannonia, Hungary, and Romania, Hungary and Bulgaria, for example, they show no evidence or very little evidence for Roman-style medical tools or tombstones with Roman names for Roman doctors, which I'm going to talk about. However, we do know that medicine was practiced in the army. Galen tells doctors that they might want to spend some time working in the army so they can learn to deal with specific wounds. And what we also have for military medicine is we have this image from Trajan's column. For example, this Trajan's column is in Rome. It's for the Emperor Trajan, and it was built in memory of his 2 Dacian wars in what's now Romania. But interesting, on this image, we have one medical scene where soldiers are fighting, and we have one soldier being helped, possibly by fellow soldiers, and another soldier having his leg bandaged. And there's a lot of debate about who the person bandaging the soldier's leg is. Is it another soldier, which would be a miles in Latin? Could be. Is it somebody called a capsarius? We know that this kind of medical personnel existed. A capsarius or a capsus was a small box, and it was probably a box used to hold wrappings for wounds, so hence the name capsarius, someone who could do quick medical procedures. Or miles medicus, somebody who was both a doctor and a soldier. Was it just a regular medicus or a regular doctor? Or medicus, a surgical, medicus chirurgicus, someone who focused on surgery. And they also had a medicus ocularius, which clearly this one isn't. But just to let you know, these are all the names found on tombstones in Roman military sites. So we know that particularly sites which were housed by units from Gaul and Spain, and sometimes Italy, that they had these different types of doctors available at least 1 or 2 of them were available at certain sites, but because they vary in name and we don't have many of these inscriptions, we don't know how often doctors with different who's focused on different types of procedures were around in the military fort. However, we do know that soldiers themselves also could perform basically what we would call triage procedures. There are a couple stories by different Roman writers about soldiers wrapping themselves before they went into battle or very early into battle to try and get out of a battle. To say, no, I'm wounded, and they apparently knew how to perform these procedures. So that's just some evidence for that. And as I did mention, along with bone surgery, we have surgical procedures to remove missiles from the body, and these were done with forceps. And there's another tool I'll talk about in a second, but I just wanted to show you this image. It's an Aeneas, a story from the Aeneid. It's Aeneas who was wounded in battle, and he is being shown the frescoes actually in Pompeii, in the House of the Surgeon. And I've shown a close-up of this image, but he has a spearhead basically in his thigh. We see Aeneas standing, he's leaning on his son, so this is actually what's described in the literature. The doctor, whose name is Iapix, is using forceps to remove the remove the missile from the thigh. However, in the story, this doesn't work, and we see the goddess Venus comes to the doctor and recommends he uses certain herbs, and these herbs help the doctor remove the missile from the thigh. However, what we see, that's the story. In reality, though, the Roman doctors probably would have used forceps to remove some sort of spearhead from the body, and they would have used iron forceps, much like the one you see in this picture, or bone forceps, and that would work. However, pulling a missile out from the body sometimes is more dangerous than leaving it in, because if it's barbed, it will actually tear the flesh as it's coming out. So the Romans suggested a few things. If there's a clear, if they knew that if it was clear and easy to push, just continue on, they would just push the arrowhead through to the other side. That was safer often. Or they came up with a few other ways if they couldn't do that. There is a description of a tool called the spoon of Diocles. We have no extant examples of it surviving, but a lot of people try to recreate it. And what the spoon of Diocles is you manage to get this spoon in around the missile. There's a hole at the bottom here where you would try and get like the arrowhead into it, and then it's rounded on the sides, so you could so it would cover the barbs of the arrowhead, and then you could carefully remove the missile head from the body. We do have a description of it, as I said, from Celsus, but as far as I'm aware, up until no examples have ever been found. Another thing Celsus recommends is using a speculum. So the Romans did have vaginal and rectal speculums. And again, you could insert these around the missile head, use the screw, open them up, and this would create a clear passage for the removal of some kind of missile. So the specula were multifunctional as well. And since I mentioned specula, I'll come on to gynecological tools in a minute, but for the most part, medicine practiced in the Roman army seems to be regionally based. Their soldiers are probably bringing their own medical practices with them. But the important thing was doctors are recommended to spend a little bit of time in the military to at least learn about battle wounds. So that would have been fairly common when fighting. But gynecological and obstetrical tools are mentioned and have been found, as you just saw, the vaginal specula, which are very similar to what a speculum looked like today. They have a screw device. The priapiscus usually has 3 prongs, and that's used to open up the vaginal area. They also have rectal speculums as well, which are smaller. So they were used for examining women. It's Galen and Serranus who writes the most about gynecology and obstetrics. He wrote in Greek. He lived in the 2nd century AD. And we learn a lot about midwifery from him and a lot about surgical procedures during very regular and unfortunately difficult labor. And also at the end of his book, he recommends care for children. So it's also a little bit of a pediatric text as well. Unfortunately, childbirth, like all, up until now, it can run into its difficulties. And they did practice procedures to try and remove the infant, whether dead or alive, from the female body if there were obstructions. And they did have obstetrical hooks for doing that. I won't go into the gory details of it, but they did practice the breaking up of the fetus as well, sometimes in the body. But the idea was to save the mother's life over that of the infant. Because the mother's life, she could go on producing more children, whereas, well, that was the idea. And then infants, didn't always survive the first few days of birth anyway. So but at the same time, there's a lot of care about newborn infants and a lot of pediatric care and a lot of literature on it. So the idea was to help raise a healthy child. The gynecological literature also talks about, how to care for a pregnant woman throughout different stages of pregnancy. And they do describe 3 stages of pregnancy, not unsimilar to trimesters today, but there are some differences. But they do talk about early, middle, and late stages of pregnancy. Okay. But most interestingly, we have is descriptions of midwifery and what should happen on a normal labor or childbirth. And the midwife, here we have an image of one. Her name is Scribonia. Her tomb is found in Ostia, just outside Rome in Italy. This is her. Then we have her helper. A midwife usually had 1 to 2 helpers with her during childbirth, and that was to help hold up the parturient or the mother. And then the midwife also carried with her a chair, and that's what a particular midwife's chair, and it was described by Serranus, and it's what we see in the image. Basically, it's a seat with an opening in the bottom, and the seat should have very strong arms for the woman to hold on to while she's giving birth. So it's nice to actually see an image of that chair that actually matches what's described in the literature. So, and then most of the medical tools tended to be found in, we do find containers for medical tools and instruments. So moving on, a doctor probably would have had a collection of containers and boxes that held his tools or her tools. We do know that women were doctors as well. There are a lot of inscriptions for the female Latin term medica, which is just Latin, female doctor, which is different from obstetrics, which was a particular Latin term for midwife. Anyway, the doctors would have probably carried their tools in these cylindrical containers for the most part, which hold general things like scalpels, probes, and also eye surgical needles, and then sometimes boxes. And then they would have also had leather containers as well for their tools. And then these boxes are sometimes found, but which could have held medicines or ingredients to mixing medicines. And but sometimes they're also found holding paints and makeups. So all of these objects are multifunctional. But what's interesting about this is a lot of these are actually found in springs and rivers, and they seem to have been ritually deposited. So we've heard a lot already about the medical procedures, the common medical procedures that were performed in the Roman period, but also these surgery was also one of the last resorts. It's always recommended as a last resort because of the shock and it could cause the patient and also sepsis. They did not have germ theory like we had today. They did not sterilize their instruments. This was unknown to them. The only thing we have available to us is stating that they just wiped their instruments off, but that doesn't get rid of germs.
And we're out of time almost.
Oh, okay, sorry. Okay, well, just very quickly, they relied on religion, so Asclepius and Hygeia. They made votive offerings at different sanctuaries, generally for eyes. We have a lot of that. Here we have somebody thanking Asclepius and Hygeia. Something seems to be for the leg, and also swaddled infants, which I'd said I'd mention. And we find ritual deposition generally of medical tools in rivers, springs, wells, foundations of buildings, and burials. So it seems like people were, as we throw pennies and coins in fountains, they're doing this with medical tools, which could represent I need help, or, you know, can you look after my body? And I just put in Coventina as well here, as up in north of Britain, which was on Hadrian's Wall, which shows, because there we find a lot of personal things being thrown into wells, and just as a lot of medical tools are as well. So I want to thank you for your time and for listening to me. Have a beautiful day, and as they'd say in Latin, bonus salus.